Welcome to the Global Businesswomen's Pod, brought to you by the Greater Houston Women's Chamber of Commerce. I am Susan Dyson and proud to be the CEO, President, and founder of the Chamber. Please join us for this empowering podcast every Thursday at 6 p.m.
Howdy, Health Explained listeners. This is Dr. Robbyn Traylor, back again with a podcast. Today, I am joined by two next level favorites. Say hello, Dr. Thomas.
Hi, everyone.
Yeah, Dr. Thomas is one of our fantastic medical directors. She's been with us since residency. Another favorite here at Next Level. Welcome, Dr. Batts.
Hello.
So, Dr. Batts is one of our associate medical directors. Again, one of the fantastic physicians we were able to recruit right out of residency, and she has just been fantastic. So we are in March 2023. This is Women's History Month. Happy International Women's Day, physicians, to you both. When I was growing up, I don't remember hearing a whole lot about like Women's History Month. I don't remember that being a thing. Everybody knows Black History Month is February, and you know, some of these other months have special recognition. When's the first time you ever even remember hearing about Women's History Month?
I think just a few years ago.
Right.
Yeah.
Right.
Growing up, we never heard about that. Any celebration of women physicians at all. So it's kind of a nice break.
Yeah, absolutely.
Honestly, I feel like I learned about it through social media. Mm-hmm. Like everyone's just sending me like,
that's exactly right.
Happy National Women's Day, and I'm like,
yeah. And so we find ourselves here at Next Level. This just happens to be a woman-owned business. There are women executives at the top of the company. More than half of our physicians at Next Level right now are women, and so I came up at a time in medicine where I wouldn't say women were like the majority of my class. Women certainly were not in the majority as I was like rotating through my medical school rotations in the hospital and like in different clinics. Now I'm starting to see a lot more women in the profession, like as medical doctors. Mm-hmm. What was your experience coming up like in training? And you know, did you see it? Were you exposed to a lot of women in medicine or women in sciences, or was it kind of a novel idea, you know, that a woman could be in medicine?
So growing up, my initial primary care physician from when I was born until I went off to college was a woman. So that was the first lady that I had ever seen as a medical doctor. But outside of that, I didn't know anyone personally.
Right.
So that way I could get mentorship and guidance along my journey. But I wish I would have had that.
Yeah, that would have been really great. I was exposed to more women physicians, I guess, when I went to medical school. Mm-hmm. And even like when I was in high school, I had some exposure to physicians because both of my parents worked at Ben Taub Hospital. They're not doctors, but they were, you know, in the, you know, healthcare milieu all those years. And so I got to see people from afar, but I didn't have like a one-on-one connection with a woman physician. My pediatrician growing up was a man. Matter of fact, both of my pediatricians were men, and they were wonderful. But it would have been really great, you know, to have that example growing up. So, wow, that's really cool. What about you, Dr. Thomas?
For me, same thing. All the physicians I went to when I was a child, I think, were all males. Mm-hmm. You know, and I don't know if it was my parents' preference because at that time that was the majority, or not. I should probably ask them. But in residency, we were about half. Our class was 12, so 6 girls, six boys. So it kind of evened everything out, and I never really thought about it until I started working here.
Right.
And this is my first job out of residency, but you can see the difference just talking to other colleagues about a women-led organization versus, you know, not a women-led organization.
Yes.
It's a lot softer, you know, it allows work-life balance and time for family. It's very, very important. Anytime a situation comes up with a family and I call you or anybody about it, everyone is very, very understanding about it. So I think that's a huge difference in anything that's women-led.
Well, truly. And I think, you know, another thing about being here at Next Level is because we're led by women, some of us just happen to be mothers. We're always focused on the family. Not that men are not focused on the family. Our fantastic producer in the room, Zach Reynolds, starts out talking about his daughter husband and his wife. Men are incredibly dedicated to their families, but moms really are the drivers of like healthcare and health maintenance in the home. We tend to be the ones who are making the medical decisions in the family. And I'm sure both of you, even as daughters, and maybe even as like cousins or best friends, are the ones that your families are relying on for like health advice. And so it makes sense for women to be well represented in the medical space. But I wanted to have a conversation today about women in medicine, and I guess particularly about the two of you. You all have been wonderful for Next Level, and I think that a lot of people here look up to you. Our patients absolutely love you. It might be kind of nice to know where you're coming from, what inspired you to go into medicine, and who might have inspired you to pursue medicine as a career. So, Dr. Thomas, I guess we'll go ahead and start with you. Can you tell us a little bit about your story, where you're coming from, and any women in your life that may have led you in this direction?
Yeah, so we are first generation. My parents came from India. They were born in India and came here and made this wonderful life for themselves. So I just saw their hard work. Neither of my parents are physicians, but my mom was in medicine, and she kind of created this company that with my dad, who's an engineer, that did really well. And just seeing somebody going from India, where they didn't know anything that was going on in America, and they came here and started their own business, just that drive alone, it's just been such an inspiration to me to see how they have grown.
Right.
And so I've always wanted to make more for my life. Because my dad always says, we have to do better than what my father did.
Oh, gosh,
and he did 100 times better.
Yeah.
So for us, it's really hard because we have to beat what they did. You know? So nobody in my immediate family are physicians, but my husband is a physician. His sister and my brother-in-law are physicians, and then my sister's husband is also a physician. So now we're
goodness.
like, it's funny because they joke. My oldest Aria says, "I'm going to be a doctor." I'm like, "Be an astronaut."
I know.
No, I'm just kidding. But we paved the way, right? So they can do whatever that they want to do.
Yeah.
So I think that's great.
Well, that's really fantastic. First generation, your parents did so well. Now everybody's a doctor. I can't think of anything more inspiring than that. What about you, Dr. Batts? Where are you coming from?
Yes, so definitely. So my family also comes back from a background of wanting to always progress the next generation.
Right.
And so my mom, she was a social worker, or she still is a social worker, and she works with a lot of different physicians. So she would always tell us about her experiences with the people that she worked with. My sister was actually the first one who decided to do medicine, and I just like math and science, so I didn't really know about engineering or anything like that. I knew either be a doctor or a lawyer. But so I was like, I just went to college and started off with pre-med. So after my first year, I actually was kind of thinking about changing my route and going a different direction. But I spoke with my dean of medicine, or dean of biology at that time, Dr. Harriet Lee Block, and she was the one who really inspired me. She said that I had the passion, the drive, the education, the knowledge to do whatever I wanted to do in life. And so that kept me along the track and journey to become a physician.
I remember being with her and being with Dr. Brown. They were incredible when I was at Prairie View, and they had this special power of making students believe that they could go the distance and be doctors. Yeah. I'll be honest, that's a lot of the reason I even went to Prairie View. My parents had warned me against going to a program that might try to break my spirit or make me feel like I couldn't do it. And Prairie View had these fantastic professors and a really nurturing environment. And yes, she wrote my letter of recommendation to get me into medical school. So I will always have a place in my heart for Dr. Howard Lee Block. And so let's get into kind of like the history of medicine here. We have a couple of articles that we read in preparation for today. The first one is from the American Association of Medical Colleges. They had an article a couple of years ago called Celebrating 10 Women Who Are Medical Pioneers. And let's just run down this list. Now, some of the names I knew, but some of these people I never even heard about. So, Dr. Thomas, we'll throw it to you. Who's our first doctor on this list?
So Elizabeth Blackwell, she was the first woman to ever be granted a medical degree. And so this is the one on the list that I definitely knew. I think every woman physician knows this one name. Because she started the journey for all of us.
Well, 100%. And she is coming up in 1821 is when she was born. Let's say that she's headed to medical school around age, I don't know, say 25 or 30. I don't know, how old a woman had to be back then, but I can imagine it was hard for her to even speak that she wanted to be a physician out loud in society. It was probably kind of a laughable idea that a woman would even want to be a professional, let alone like an actual medical doctor. So, in this moment, we honor Dr. Elizabeth Blackwell. Okay.
And just in that same vein, she was admitted as a joke,
Oh, yeah.
So her classmates voted her in as they thought it was a
That's
prank.
right.
Yeah, so that's amazing that it was just so laughable to them, like you were saying. That they admitted this person in as they thought she would just utterly fail or whatever. Yeah. And she made it through, right? Yeah. And she led the way.
Okay, so the next one on our list, Dr. Batts, I'll let you speak to the next person on our list. Who do we have here?
Yes, so the next one that we have is Dr. Rebecca Lee Crumpler. She was the first African-American woman to earn a medical degree in the United States.
Right. So Dr. Crumpler is a very interesting figure in American history because she is born in 1831. Obviously, back then, slavery was the law of the land, and she decided that she wanted to be a doctor. And so, what are the steps that she took? How did she even get there? Because it seems like an impossible dream. To me, even looking back at the time when she wanted to learn, it seems nearly impossible that she would even be admitted into any medical college. But what was her deal, Dr. Batts?
So it says she worked for 8 years as a nurse back in Charleston, and in 1864 she completed her education for that. And then following the Civil War, she decided that she wanted to be able to treat those who were enslaved, or who suffered from rampant racism and sexism because people didn't want to treat them as good as they were treating the other.
Well, I have found that is kind of a common theme among women physicians. Oftentimes there is a community that we want to help, an underserved community, or a group of people that we can relate to, or we recognize the suffering in people. And I think that something that women do incredibly well. Now, some people might even call it maternalistic or something like that, but I want to be careful not to denigrate or take away from the determination of any of these women. They were intellectuals, they were brave, and they wanted to help people. And so Dr. Crumpler and Dr. Blackwell really had to overcome whatever kind of societal prejudices existed in the day and still persevere, to go on to become doctors. And so I just think it's amazing that she even got over the hump and earned a medical degree, and went on to help so many people in her day. She even published a book. It's called A Book of Medical Discourses. I actually have never even read that book, but I'm going to make it a point to read it before Women's History Month next year. The next person on our list, Dr. Thomas, I'll throw to you. Who do we have?
So we have Mary Putnam Jacoby. She was alive from 1842 to 1906. And she kind of debunked that menstruation myth.
Yes. And so that's pretty interesting. It looks like she was fighting for her female peers, and she wanted women to have the same clinical experiences as anyone else. And she was fighting all kinds of inequity in her time. And so, again, menstruation, women's history, I'm not even sure if when she was learning and practicing, if that was something that was necessarily studied or known about, if anybody had any kind of focus on women's health in the day. but we are grateful for her contribution to medicine. Okay, so let's talk about Dr. Ann Preston. Dr. Batts, what do we know about her?
So Dr. Ann Preston was the first woman dean of a U.S. medical school, and her main goal was to fight for the opportunities for her female students.
Well, that's really cool. I mean, again, she is someone who comes after Dr. Blackwell and Dr. Crumpler, and she can view the medical landscape. She knows that women are capable of being physicians, and not only does she want to be a doctor, but she wants to actually lead a medical school, which, you know, I'm sure at the time was just completely unheard of, especially here in the U.S. So shouts out to Dr. Ann Preston. We remember her and honor her contributions in this moment. Who's the next person on our list?
We have Dr. Susan LaFlèche-Picotte. So she was devoted to healing Native Americans. When she was younger, she saw a Native American woman die because a white doctor refused to care for her.
Wow.
So once she became a physician, she devoted her care to Native Americans.
Wow, that is really, really something. And I mean, again, for anyone who grows up in any kind of marginalized community, if you have a heart, you can see that people need care. And so she decides that she is going to be the solution for her own community, and she goes on to become a physician. She eventually opens a hospital in a reservation town in Nebraska. So very, very cool that she was able to receive the education and then bring it back to her community. All right, so our next person is a Nobel Prize winner. Dr. Batts, who do we have next here?
So we have Miss Dr. Gertie Teresa Corey.
Okay.
So she actually won the Nobel Prize explaining how glucose is metabolized, which is super important because it's how we treat diabetes today.
Oh my gosh. Okay, so Dr. Gertie Teresa Corey, PhD, won a Nobel Prize for teaching us about glucose metabolism. And, you know, obviously today in America, more than half of Americans are diabetic. We're somewhere on that scale, whether you're pre-diabetic or just very brittle diabetic or uncontrolled diabetic. And like someone has to be the pioneer to even discover the thing. And it's kind of cool that a woman was one of the pioneering scientists and researchers to even discover this disease that still has such a major impact on our society today. And so, you know, she eventually wins the Nobel Prize, which, oh my gosh, you know, at the time, I remember learning when I was studying that two guys named Watson and Crick discovered DNA. And it wasn't until later that a woman named Franklin was actually key in the discovery of DNA and wasn't even recognized until posthumously. And so I think the fact that Dr. Corey is recognized during her time, this is someone who was born in 1896, and she is deceased in 1957, is really, really a very important figure, not just in women's history, but in science history, and shows women of the day the possibilities, you know, for how far we can go and what big impact women can have on the entire medical landscape, whether it be like as a medical doctor or as a scientific researcher, you know, PhD like Dr. Corey. Very, very cool. Okay, so the next name is one that I recognize, but I'll be honest, I did not know that this person was a woman. So Dr. Thomas, is it your turn now?
I think so.
Okay,
yeah.
so who is our next person?
So Virginia Apgar. I did not know this was a person, actually. I thought it was just a clever acronym.
I thought it was a cool acronym. I didn't know it was a person. So what did Dr. Virginia Apgar do for us in medicine?
So she created the Apgar score, which is a score we give newborns right when they're born, I believe 7 minutes after, to assess how well they're doing.
Yes.
And it's pretty spot on. So it's just amazing that she matched it up with her last name too. But,
Well, and it's been a long time since I had to deliver a baby, but back then, Apgar was really like one of the first scoring tools that we would use to assess babies' vitality and whether or not they seemed healthy right there at birth. And you know, here we are all the way in 2023, and I'm pretty sure we're still using APGAR scoring today, you know, in the delivery room. So shouts out to Dr. APGAR. It looks like she was the first director of Columbia Presbyterian's Hospital Division of Anesthesia in 1938. Sheesh. I mean, wow, what an incredible pioneer. But she goes on to get a master's in public health at Johns Hopkins University, and eventually works at the March of Dimes as the vice president for medical affairs. Dr. APGAR, who knew?
And I love this quote from the former U.S. Surgeon General Julius Richmond that said, APGAR had done more to improve the health of mothers, babies, and unborn infants than anyone else in the 20th century.
Yeah.
It's pretty powerful.
Well, that is very powerful, and she's even making impacts now in the 21st century. So big recognition for Dr. APGAR. Okay, so who is our next scientist?
So our next scientist is Dr. Patricia Goldman.
Okay, so what is Dr. Goldman doing for us, Dr. Batts?
It looks like she mapped the region of the prefrontal cortex, which gave us more insight to diseases like Alzheimer's disease, cerebral palsy, Parkinson's disease, and also schizophrenia.
Okay, oh my gosh. So right now there's some incredible medical breakthroughs happening in the Alzheimer's space. There's some immunotherapy advancements that are being made. We are diagnosing Alzheimer's before patients have any sign of the disease. So I guess really what we're doing is finding who's at increased risk, and possibly even like pre-treating those people so that we can either delay or prevent dementia from happening. But first, you got to figure out what the thing is. And this fantastic Dr. Patricia Goldman Racket, she is mapping the brain, and she is showing us exactly where Alzheimer's disease, cerebral palsy, Parkinson's, schizophrenia, has its effect on our prefrontal cortex. Very cool for her. Who's the next person on our list?
I have Antonio Novello. She became U.S. Surgeon General in 1990, and she was the first Hispanic woman to do that.
That is incredible. You know, I am a kid in the 90s, and I'm sure she is probably one of the first national figures that I am even introduced to as a girl. I think that's so important because I know my mother didn't have anything like that in her view when she was coming up as a girl. So this person is Surgeon General in 1990, and she comes to us all the way from Puerto Rico, where she went to medical school. Very cool. What else do we know about Dr. Novello?
We know she was just committed to battling health inequities among the poor and minority groups, which is so important as Surgeon General.
Well, so she's battling health inequities. You know, she's from Puerto Rico. She considered pediatrics, but I think she decided that she really wanted to cast a wider net in medicine and maybe not treat just children. And so very cool that not only is she a woman, but she's a brown woman in a very powerful position for the United States back in the 1990s. Awesome. And Dr. Batts, you have the final person in this article. Who is she?
She's Dr. Jocelyn Elders.
Okay.
So she actually is the first African American Surgeon General. And the interesting thing is that she grew up poor in Arkansas, and she didn't see her first doctor until the age of 16.
Oh my gosh.
At which time she knew right then that she wanted to become a doctor.
Okay.
So after serving in the Army, she went on with the GI Bill, went to the University of Arkansas Medical School, and became the first board-certified pediatric endocrinologist.
Oh my gosh.
Yes.
Wow. Well, I have memories of seeing this person when I was growing up. And again, it's, you know, when you're a kid, you don't even realize when you're being influenced and when you're being inspired. I think for me, I knew that if I could see it, I could be it. And this lady had not even seen a doctor until she was 16 years old. So the idea that she goes to the military, becomes a doctor, becomes Surgeon General, a pediatric endocrinologist, for goodness sakes, is like, It just blows my mind. Right, exactly. So I wanted to end this tour through women's history and science by talking about a doctor that I learned about during the COVID pandemic. Her name is Caitlin Carico, and I hope I'm pronouncing her name correctly. She is a PhD scientist who was born in Hungary and immigrated to the United States around the 1970s. And she learns about mRNA technology around that time. Later on, she and other scientists that she's working with are thinking mRNA might be a reasonable tool for vaccinating people, for creating designer drugs for people, because she understands that mRNA creates proteins, and proteins are going to determine what kind of people we're going to be. And so her thing is, well, if you don't have to change anyone's genetic makeup, you don't have to change the DNA code, you just have to know how to give your code the right recipe. And so she is using mRNA and comes up with this breakthrough discovery of mRNA entering the cells to take over our ribosomes and create like good proteins for us to help us get over disease or to help us tolerate medicines better or anything like that. And so she really is what I'm going to call like an immunotherapy pioneer. And so it is her science along with partners that she worked with at the time that really helped to rescue us out of the pandemic. This is the woman that discovered mRNA vaccine and mRNA technology. And she went on to help lead the BioNTech company with Pfizer. Another partner of hers from the time went on to kind of start Moderna, and they bring us these mRNA vaccines, which really help to get us out of the pandemic. And so women are everywhere. Women are everywhere. Women are incredible and amazing. And I know that all of us get to sit here in this room because of the incredible achievements of these women in science. And so I'm very grateful to get to work with a lot of fantastic women, but especially the two of you, Dr. Batts, Dr. Thomas. You've made such significant contributions to Next Level and what we have become today. This company this year is going to be 10 years old in July. And you all have been with us almost half that time. You've really helped to kind of like shape the kind of medicine that we're able to deliver to patients at Next Level. So I'm really honored that you were able to join me today to talk about women's history in science, and that you're making your own history at Next Level.
Yes, I'm honored to be here.
Yes, same. Thank you so much for having us.
Well, Health Explained listeners, thank you so much for tuning in to our podcast. We look forward to talking to you again real soon.
Thank you so much for joining us. We will see you again next Thursday at 6 p.m. For more information about the Chamber and our podcast, please visit us at GHWCC.org.